Hi, in this series on prognosis, we'll talk about the curability of psoriasis using homeopathy. Well, psoriasis, as you possibly know, is a chronic, progressive, complex, complicated disease, and it is caused by multiple factors which include immunological parameters, genetic factors, environmental factors, chemical factors, stress factors, and some unknown factors as well. A lot has been said about psoriasis, and some people might even claim that psoriasis can be cured very easily with homeopathy. I would give some insights based on our humble experience in treating psoriasis of around maybe 5 or 7,000 cases from all over the world. My name is Dr. Rajesh Shah. I am a director of Life Force, where we treat patients from all across the world, including psoriasis, of course. Psoriasis has a tendency to go into relapses and remissions. It means it comes and goes. It may come and stay for 2 years, 3 years, 4 years, 10 years, and may go away, may disappear for maybe a couple of years in the natural process also. Psoriasis can be mild, it can be very severe, it can make one's life miserable also in some cases. The curability of psoriasis, I'll put it in the categories like A, curable, B, partly curable, C, controllable, 4, incurable, and 5, reducing the drug dependency. So I'll try to put psoriasis in these categories depending on various stages. The cases of psoriasis which can show significant results of great improvement are those cases especially which are of recent origin, not very extensive, and those who are not heavily drugged with immunosuppressive medicines. These cases are likely to see significant recovery, complete disappearance maybe for a couple of years or few more years, and it may go into a remission, a disease-free period. Another category of psoriasis which is partly curable is that in which psoriasis may be quite widespread on many parts of the body, or even one including guttate psoriasis, large patches, multiple locations for a few years without any remission, and who may have been treated with some medications here and there. This variety of psoriasis could show significant recovery but not complete recovery. The third variety, I would say, which is controllable, is that which has been drugged heavily, who is on heavy immunosuppressant medicines, corticosteroid applications, oral corticosteroids, or even stronger immunosuppressive medicines such as methotrexate. These medicines one is taking for a long time makes the recovery of the disease eventually more difficult. I would put it under controllable variety. It is very difficult to treat and recover cases of psoriasis in my experience who have been on methotrexate for a very long time, and it is very difficult to reduce this medicine because that leads to eventually a severe flare-up or a relapse, and that relapse is at times very difficult for the patient to pass through. So methotrexate dependent psoriasis is very difficult to treat. And the last variety of vitiligo, I would say, is incurable, is one which is just not resistant, which is just not responding to immunosuppressant medicines, which is very extensive and which may have also led to severe form of psoriatic arthritis affecting the joints, which are inflamed, swollen and deformed. This variety of psoriasis with psoriatic arthritis is extremely difficult and is almost incurable. We may give some partial relief, some palliation, some alleviation, but to treat this significantly is very difficult. Some of my views might not be appreciated by some homeopaths who might believe that every case of psoriasis is completely curable. Well, in my humble experience of treating a few thousand cases, I would like to say that it is not the case. Does that mean homeopathy is indicated or not indicated, recommended or not recommended for psoriasis? I would strongly say that homeopathy is very strongly recommended in most cases of psoriasis, especially in the categories which I described as 1, 2, 3, that is early cases, curable, partly curable and controllable variety. All these varieties, and for this type of psoriasis, homeopathy is very strongly recommended. The only category in which homeopathy is not strongly recommended is one which is on long-term use of methotrexate. And there it is very difficult to take them out of this condition and the drug dependency. What is the duration of the treatment of psoriasis? Well, it takes time. The initial improvement in most cases of recent origin may be seen within 6 weeks to maybe 2 months or 3 months time. However, some cases may take much longer to show results, and the overall recovery or the full recovery or large recovery may take maybe a year or longer. Sometimes you need to be treated for maybe 2 to 3 years or even longer than that. As I said, it's a complex disease. Individual variations are there. Every case is different. Even if you can reduce the drug dependency, even if we can help you reduce or stop the use of corticosteroids, oral or topical, it is considered, and it should be considered as an achievement in the cases of psoriasis. I hope this information based on the experience will help the general public as well as the homeopathic doctors, the conventional doctors as well as the medical students. Thank you so much.